Nightingale, that came out in Wall Street Journal. That's when Ascension went to Google and said, look, we want to bring all of our records together and make it easier for our physicians and easier to do this kind of data work that's required across the system, especially in a pandemic and with public health and whatnot. Then Mayo Clinic came out and signed a deal. Then Providence, there was a period where, I mean, these deals were being signed pretty regularly. So Mayo did a deal with Google, Providence did a deal with Microsoft, and the big question is privacy. So HCA said Google isn't permitted to use the patient identifiable information under the agreement. Dr. Perlin said HCA patient records would be stripped of identifying information before being shared with Google data scientists, and that the hospital system would control access to the data. Terms of the deal weren't disclosed by the companies. And it's interesting, before Mayo did this, John Halamka did a lot of speaking about how they were doing this at a much more sophisticated level. Not only were they stripping the data, there was absolutely no way that Google could see a Mayo Clinic identifiable patient record, but they were still getting the benefit of that. I share this story because I think it's an interesting story, and I think it's a direction that we're going to see more and more. It's health systems tapping into advanced capabilities that we may not even have the ability to build on site, even if we wanted to.
Yeah. No, I mean, some of this too is, it's a good story of transparency, right? Because I think I remember when the first, was it Ascension? I remember when the first story came out, the world was horrified and lots of people got really upset. And since then, more and more of these stories have emerged as sort of reassuring that this actually is a good idea. And with folks like John Halamka telling the story, it's all about value. It's all about building things that are better for patients and families. This is the only way that we can probably really do it. We have to have these big numbers, and they have to be in big computers, and we have to have super smart people looking at this and figuring out what these patterns are. And doing it in the cloud is really the only way to do it. And so I think you see more and more of that transparency and more of that good storytelling about why we're doing it, how it's going to benefit the patient, which took a lot of the pressure off of health systems.
Yeah. Well, I mean, the thing that's different about Ascension, quite frankly, is they are sharing identifiable information, but the way that it was written, the access by Google is very limited in terms of them being able to actually access the record. And really, it's more of a technology play than anything else.
Got it.
So it's interesting. This one statement in this article sort of has me scratching my head. Some consider the federal law outdated, saying, and it's talking about essentially HIPAA, saying that the law's protections haven't kept pace with the technology sector's growing demand for patient data, said Michelle Mello, a Stanford University professor of law and medicine who focuses on health data privacy. I would love to have Michelle on the show because I think I read the statement, I'm like, the federal law is outdated, saying the law's protections haven't kept pace with the technology sector's growing demand for patient data. What about the patient's need for privacy?
Privacy, yeah.
Like what? Since when are we writing the laws so that the tech sector can get access to more patient data?
Yeah. Things, a lot of things have changed since. One was 99, 98. I don't remember when we got HIPAA. But a lot of things have changed. And undoubtedly, if you went through it with a fine-tooth comb, there's probably adjustments and changes that we should make.
I'm not arguing it's not outdated. It really does need to be, we need to relook at it.
But the driver shouldn't be that tech organizations need access to patient data. I got you.
Yeah, let's just have Amazon, Microsoft, Google sit down and write the new HIPAA law.
It
doesn't sit well with me.